At the height of the pandemic, San Diego's wastewater program gave scientists a way to anticipate COVID-19 infections.
We learned that we could predict surges, we could detect variants as they reached our local population, in many cases, even faster than we could by doing individual testing of infected persons.
Dr. Louise Laurent worked on the project. It was a collaboration between UC San Diego, Scripps Research, and Rady Children's Hospital. She says last week, the San Diego Epidemiology and Research for COVID Health program came to a halt. County officials say it's a direct result of federal funding cuts. The program didn't just detect COVID pathogens, says Scripps research scientist Josh Levi.
What we ended up doing in San Diego that really has distinguished us and allowed us to really lead nationwide is to start sequencing that wastewater and to figure out all of the different variants and subvariants and lineages that are emerging.
He says the pause means no more local sequencing, no new samples, and no way to track emerging threats in real time.
That means that we'll have a huge gap in terms of our ability to understand what has happened and what will happen in terms of the virus's evolution and spread in the community going forward.
UC San Diego's Dr. Robert Schooley says gutting public health protections now is dangerous, especially with rising cases of measles and bird flu.
Infectious diseases are here to stay, and it doesn't make sense to take away our ability to combat them.
He says wastewater activity was a key tool he used to advise immunocompromised patients.
To assess their level of risk and to know when to really mask up and when to stay out of circulation.
The county had been contributing about $600,000 in federal funds annually to the partnership. Officials say they will continue to monitor respiratory viruses through other methods and plan to add in-house water testing later this year. Heidi de Marco, KPBS News.